Good morning, everyone, and Happy New Year. Welcome to the third meeting of our Justice 40 Oversight Committee. I am your chair, State Representative Larry Lambert. I represent the 7th District, which includes Claymont, the Ardens, and Brandywine 100, and I'm joined by the co-chair, Senator Pinckney. We want to thank everyone for joining us this morning. We all know you are very busy. There's a lot going on. And we just really want to thank all of our fellow committee members, our fellow representatives, fellow senators, secretaries and directors. You've really gone above and beyond during these challenging times, and cutting into your day is something that we don't take lightly. We respect your time. And today we have a lot of good information, but I know that time is limited. So I want to start by sharing my screen so that we can get into our day. Welcome to the Justice 40 Oversight Committee. Dylan, we can start with the roll call. Thank you.
Sure, yes. Representative Lambert.
Here.
Senator Pinckney.
Here.
Representative Heffernan.
Here.
Representative Shoup. Senator Brown. Senator Lopez.
Here.
Secretary Majeski. Jim, are you here on her behalf?
Yes.
Director Coach Johnson.
Here.
Director Christ.
Here.
Director Young.
Here.
Secretary Garvin.
Here.
Secretary Skewes.
Good morning. This is Jimmy Crone. I'm here for Secretary Skewes today.
Director Fernandez. And Michelle Roberts.
Here.
All right, Representative Lambert, I think we are able to start.
Excellent. Our agenda today, we're going to start with approval of the minutes, and we're going to go into our mapping tools today. A big part of our Justice 40 Oversight Committee, our committee dedicated to ensuring that when it comes to federal infrastructure funds from the Build Back Better Act, that when it comes to infrastructure funds around climate change, green energy, sea level rise, pollution remediation, that at least 40% of those funds go to our overburdened communities that have been disproportionately impacted by pollution, by poverty. So in regards to that, we want to make sure that we are in alignment with our current mapping tools in order for us to know where we are going in regards to the distribution of investment benefits. We have to know what we're currently working with. And that's why we want to have today's meeting, where we are not only providing information, but we're also opening a dialogue. We want to thank everyone for joining, as well as our wonderful community ambassadors. You've really gone above and beyond. And I want to give the shout out to the community. Last Thursday, the day before New Year's Eve, the community had a Justice 40 meeting. It was with the auditor's office in regards to the Gray Fox Initiative, how they map the investments at the state, county, and municipal level around the ARPA funds, which is something that we might be able to utilize in regards to looking at the investments coming in for Justice 40. So in that regard, let's get ready and get started. I did want to share this slide real quick, showing the 5 overarching steps of the Justice 40. We've been through the process of determining what constitutes a disadvantaged community, which is step 1. Last meeting, we did start to identify some of the, well, we started talking about how some of the programmatic benefits are distributed from the agencies down to our communities. And one of the things that we're doing today is to look at how do we map our overburdened communities. And we are having presentations from both the Department of Health as well as DNREC. With no further ado, we can get into the mapping tools used by DNREC. Secretary Garvin and team, you may begin. Thank you.
Thank you, Representative Lambert. Before we get to that, I don't think we discussed the minutes, but I did want to go back. There was one correction on the minutes that I had, which was on page 8, the second entry from me, third line from the bottom, it said state version of EJ Stream. It should be EJ Screen. Just so that that's clear, which I also think is a good segue to the presentation that we are going to make.
Thanks for flagging that. We appreciate that.
Absolutely. And I do apologize. I will have to jump off early. I have another engagement that I have to get to. But I'm also joined with by Mark Biddle. I'm trying to find Mark now. There he is. Who's one of our technical folks who have been working with a group of technical folks in the department on our EJ mapping tool. And at the last meeting, we kind of went through some of the EJ efforts, building on EJ efforts that have been engaged in the department for years. And one of the things Representative and Senator asked us to come back and just kind of give an update on where we are on our EJ tool. And this is going to be this mapping tool is going to be kind of an evolution, and Mark in a second is going to run through what he and his colleagues have been working on. But just kind of a quick 50,000 foot look at it is, there's a number of tools out there, and DHSS is going to go over kind of the health screen tool that they have in place. And there's EJ Screen, which is the EPA tool, which was developed when I was there in the region. And we really felt like our ability to create something that is a little bit more parochial to Delaware, utilizing things that are already done by the Division of Public Health, things that are already in existence at the federal level, and really turn it into a Delaware specific tool as it relates to the environment at EJ and how it crosses over with health. And that's something we've been working on for well over a year now. We wanted to come back and give some updates. This is going to be an evolving tool. What we're looking to do is put pieces together, kind of identify what we think are the clear pieces that would be beneficial as a communication tool and as a tool internally that we can use, and then get feedback both inside the department as well as from stakeholders, and then kind of evolve from there and figure out what pieces need to be changed, what pieces need to be added, suggestions that folks have. And so the first goal is for us to get something out on the street, and I lost Mark. Oh, he's back. I want to turn it over to Mark, and I think he has a really quick PowerPoint presentation just to talk about what we've been working on and what the goal is. So
Thank you, Secretary Garvin. As a point of order, we're going to go to Dylan real quick for the meeting minutes.
Okay.
Yes, Larry, I'm trying to help Mark through some technical issues. So if you'd like to start on the vote for the meeting minutes.
Excellent. Let's see, has everyone had an opportunity to review the meeting minutes from our last meeting? Do we have a motion to approve the meeting minutes?
So moved.
Do we have a second?
Second, noting with the change I made earlier.
Excellent, thank you. The motion is approved. Thank you, everyone. And Secretary Garvin, to your point, if anybody has any feedback around this presentation, the EJ screening tool, they can provide their feedback not only to us at Justice40 at delaware.gov, but where can they provide feedback to your office?
We will get you the best place to respond back to us. Probably will be Martina Johnson, probably, but let me confirm, and you can get that information back out.
That sounds good. And
Representative Lambert, you froze.
Looks like we lost Rep. Lambert for a moment. Do we want to do the count for the approval of the minutes, Dylan, or are we okay with just a motion and a second?
With a motion, we should be fine to go. Mark, are you able to speak now?
Mhm. It looks like he's still connecting.
Can you hear me?
Yes.
Okay. Yeah, I had to call in. I'm not sure what's going on with my computer audio.
All
Mark,
right.
would you like me to bring up the slideshow you shared with me?
Sure. You ready to
I'll
go?
give me one moment. Can you guys see the screen?
Yes.
Okay, Mark, you should be able to go. You should be able to speak.
Okay.
Just
Sounds
let me know
good.
when you'd like me to move along the slide.
Okay, great. Thank you. So good morning, everyone. My name is Mark Biddle, and I'm an environmental scientist with DENREC. One of the focus areas of my work is conducting landscape level analysis at various scales. And that could be statewide, it could be countywide, it could be at the community level or even site level. And that type of analysis combines many data sets and other relevant information to understand what's happening on the landscape and how to plan for improvements. Secretary Garvin asked me to introduce you to a project that is starting within DENREC, and this is the Environmental Justice Discovery Tool. It also can be described as a screening tool or analysis tool. The project is to design an easily accessible website with data and information at the community level for stakeholders to access and understand the information and use it as a communication tool when working with community groups, nonprofits, and government agencies, which helps identify opportunities for improvements. DENREC has an internal environmental justice committee, and one of their tasks is to create a mapping tool along with other helpful information to better understand and define environmental justice areas of concern. That task is the creation of the Environmental Justice Discovery Tool. As you see on screen now, currently we are entertaining quotes to build this online hub or a website that will include a mapping function as well as other helpful information sharing. We've already assembled a long list of geographic spatial data and provided that to the potential contractors. Plans are in the works for assembling an internal DENREC technical advisory committee of staff with specific expertise that will assist with the effort and will advise the contractor once selected. If all goes well, the contractor should be selected in the next month or so. Fine. All right, so the project will be completed in phases, and we want to allow plenty of opportunity for the public and legislators to provide input. The internal technical advisory committee will work with the contractor to review all the data and information that we feel is important to build this discovery tool, and we will also identify any data or information gaps, including how to address and gather missing information that we would need to make the tool all it can be. Part of that work will be to take a look at existing tools that are out there. For instance, the EPA's EJ Screen, the Healthy Communities website, and EJ websites from other states. There are a few other states that have very nice environmental justice websites, and we want to make sure that we identify the best parts of some of those other existing tools that we can build for Delaware. But most importantly, what we want to build must be easy to access, easy to use, and easily understood. I mentioned that we had already assembled a whole list of important data, and this kind of gives you a sense of the types of data we are reviewing. We want to make sure that we're looking at all data and information, areas where there are impairments, say to drinking water or sewer, combined sewer overflows, for example. But we also want to look at where there are positive aspects, such as access to parks and to green spaces. To give you a visual example of what the mapping part of this tool might look like, I'm showing a clip of the Delaware Watershed Resources Registry, which looks for and identifies preservation or restoration opportunities on the landscape. So in this example, the screening application is looking for compromised stormwater infrastructure. So that would be like areas that were built out prior to any stormwater regulations or any stormwater controls. And so, flooding then ends up being an issue in those types of locations. So we would be looking for areas to make improvements to controlling stormwater in these areas, so that residents don't have the flooding issues. And as you can see, there's a whole list of other individual data to the left that can be kind of turned on and turned off for viewing. So it's just that much more helpful to be able to do that. And the box in the upper right there is sort of that screening application that you can bring up to look. But here's another look at the same tool that shows different data that is turned on while also showing two opportunities in the list or the table at the bottom. So this screening application gives you a set of information that can include, all kinds of data and information, such as, size and acreage, the watershed or community it might be in, the impairments, public protected lands nearby, et cetera, et cetera. The environmental justice discovery tool will have a very similar, if not better, function such as this site has. The next slide. Along with having the mapping function of the tool, there will also be other information sharing functions, such as something known as dashboards. And so some of you may be familiar with dashboards. It's just an easy way, it's a quick and easy way to share data about individual communities and the current demographics. This example is from the CDC website, and it gives you a sense of what the Delaware tool will look like. So when you go into this website or to this hub, you'll have an opportunity to click on the mapping aspect of it, or to kind of go into these dashboards that give you different information. And it just makes it really easily and handy for access and understanding. Finally, the goals of the project are straightforward. The tool needs to be easy to use, right? Easy to find and easy to understand and accessible, with cell phone, on PCs. You want to make it as accessible as possible. That could even be in public locations, maybe like libraries and things like that too. The focus will be at the community level scale, and community stakeholders and community groups will be engaged through the process, and will be, they'll be an important source of local information and conditions. It's also important to note that this will be a living tool, which basically means that the data and information will be continuously updated over time, including tracking positive changes that have been implemented. The tool will help to inform, future planning and improvements for both environmental and health factors. So at this point, we hope to have kind of like the first phase completed and ready for external review in about 6 to 9 months. Slide. That does it for me. I want to thank you for the opportunity to present what we're starting to crank up here at DENREC, and I'm not sure if anyone has any questions, or if Sean, you'd like to.
Yeah, just real quickly, and you touched on it briefly when looking at sources. The other thing that's in development, which we are looking to have a soft launch, is also an environmental justice overburdened underserved community webpage, link on our webpage, so people can easily go to that webpage, which will be where you can get a link to this tool when it's developed, to get a link to other things like definitions or other news or actions, so that everything will be housed in one location. So make it as easy as possible to access all this information, and so that people don't have to try to search all over the place to find bits and pieces. And the idea on that would be, we're putting kind of the framework together, have a soft rollout so that we can start getting input on, much like the mapping tool, what folks think are working, what think needs to be added, or change of look or information. So those two things are kind of happening in tandem, separate efforts, but will be complementary of each other.
Hey, hi everyone. Representative Lambert is still having some technical issues. Michelle, what is your question?
Thank you for that. Just very quick questions. How are you tracking changes over time? What methodology are you using, such as that as the continuance of climate crisis, which we just, experienced with the floods, COVID-19? In addition to that, how are we also looking at addressing legacy pollution, contamination, and exposure with the onset of being able to really fully address that of cumulative impacts that many communities are pushing and thriving for, and also looking at, given the climate crisis, the need for the mandatory emissions reductions. So with respect to all of that within this tool, how are we going to be able to address those pieces? And last, thank you for mentioning EJ Screen, because one of the challenges that EJ communities had with the onset of EJ Screen was that it did not fundamentally address that of the cumulative impacts on their communities. And so we'd like to know how those will be incorporated. And very last, how, given the issues of infrastructure and the impacts from racial segregation along the development of the southern part of Wilmington, specifically, i.e. Route 9, how will that plan be articulated in this screening tool to be able to help with Administrator Young and the housing challenges we are experiencing along the Route 9 industrial corridor that is separate and distinct from that of the stormwater challenges? And I'll just hold right there. Thank you so very much for this effort. Appreciate it.
Thanks, Michelle. And there was I think a lot packed into what you just laid out, and I think the simple answer is that's part of what we're trying to figure out. I mean, this will be used as a tool both internally for us to help make decisions, as well as a communication tool externally. And some of the things that you outlined are the challenges that we face. This will be a tool that helps us better tackle some of those issues. It's not going to be the end all be all in which it's going to necessarily address transportation issues or housing issues, but it is a tool that I think will be helpful in our conversations. And I want to point out, and I think I stressed this the last time we met, our initiative for Clean Water Initiative for Underserved Communities was a partnership between DHSS and Housing and DENREC to try to identify the communities and the needs, and where there are both stormwater and drinking water needs as it relates also to housing and these overburdened, underserved communities. So I look at this as being another tool that helps us in those conversations. I don't know that we'll have layers for all of those aspects, but will be a tool that helps us in those conversations. So that's part of what we're developing, part of the feedback, and part of what we'll be working with the contractors to see how we can build in what. But as I said, I think we're going to really start with the low-hanging fruit, get that out, start getting feedback, and then figure out what layers to add after that. And so even the way we're approaching the contract, they know it's a phased approach for us to build this out so that we can have real interaction with communities and community leaders on what this tool should look like, and have it be evolving over the course of time to continually to meet the needs. And some of the things that you outlined are part of that discussion.
Hi, Representative Lambert, are you able to connect now?
Good morning, everyone. Sorry about my technical difficulties. I apologize.
Hi, Dory. I think you had your hand up. No, excuse me. Hi, Jeffrey, you had your hand up next if you'd like to speak.
Dylan, excuse me, I'm sorry. Before you go to the next question, just kind of keeping on track with the questions that Ms. Robert just asked. Secretary Garvin, thinking about the ways and the intersectionality that occurs within environmental justice, are you guys already having these preliminary conversations with other agencies about how this tool can be used in the work that they're doing? Like even thinking about what Ms. Roberts said about the housing issues on Route 9, where I grew up, where my mom still lives. Like, are you connecting and having conversations with our amazing Secretary Young, Director Young, sorry, excuse me. Like, are those conversations across agencies occurring?
Right now, primarily with public health. We're working on kind of linking that up, but we envision having further conversations. Again, not necessarily having our tool have an overlay for all of those things, but figuring out where there's a connection there.
And can I just jump in for a quick second? So one of the things that we're also working on, Senator Pinckney, you said it 100% correct. Like there's a lot of, with all the movement and moving pieces that are going on right now, throughout the state with funding and things of that nature. One of the things that we've discussed is and we've been working with DHSS, like we've been coordinating. I think we'll be wrapping around our arms around a lot of this, certainly as we move forward. And I'll be working with Sean and team to figure out ways that we can kind of come together on some of these specific areas where we're all kind of putting a concerted effort. So I think it's something that certainly is being talked about, and it's certainly something that will happen. Certainly you'll see a lot more as we move forward. So I just want that to be known. Where we will be heading is going to be looking totally different than where we are certainly today. We're very much at early stages of.
Fantastic, thank you. Dylan, I also just wanted to recognize that Secretary Fernandez joined us. Welcome, Secretary.
Yes. Yes, thank you, Director Fernandez. Hi, Jeffrey. I think you had your hand up next if you'd like to speak.
Oh, okay. Can you hear me?
Yes.
Great. Thank you very much. And just in line with the other questions that have been asked, which are getting right to the core of so many of the issues here. How do you see a tool like this connecting to the development of policy? I know in working in different states and having seen the development of different systems, the enforcement is where many things like this tend to break down. And so once we gather data, it's useful for communities to have that in the work that they do, organizing, et cetera. But the actual enforcement is where things break down. I know Michelle mentioned things like legacy pollution, and then there's the issue of why do we have legacy pollution and what policies were not being put in place in the past to put us in a situation where we have such an inordinate level of pollution in the state, which means there's been some level at which there's been a failure or breakdown somewhere in the enforcement of policies. And that's a great concern. Doing some work in this EJ environment and teaching a class actually related to this and looking at a lot of case studies. One of the things that comes up is the toxic release inventory. It shows Delaware, at least the last time I looked, as being number 2 in the country for the amount of toxic releases per square mile, number 2 in the country. That's ahead of even Louisiana with Cancer Alley. And so this has significant implications for the state. And how do we connect the gathering of information to policy development and critically enforcement of policy? Legacy means that something wasn't done in the past. We must look at that, as Michelle Roberts mentioned, and then moving forward, how is this going to be used and how do we have those discussions around enforcement? And this obviously is going to involve at some level the business and corporate sector, because those interests tend to be significantly important in influencing how policy is enforced. And so I'll stop there. There's a lot of other things in relationship to job creation and other stuff in infrastructure, but if you can address that, then that would be tremendous. Thank you so very much for this opportunity.
Thank you, Jeffrey. And you raised very critical points, and really any policy decisions, any permitting decisions, things that the department looks as investments. The more information and the more that we have it in an easy usable manner, both for allowing citizens to provide their input on whatever we have in front of us, as well as our staff, and having that information and being able to look at areas and not look at necessarily a permit in a vacuum or a change in regulations in the vacuum. And so the goal of this is to create a tool that makes it easier for us to have a vision of what that information is, to help to inform whatever policy decisions are being made. Any regulatory changes that we're making could be statutory changes based on what might be needed. And so this is a way for us to gather information and make it as usable as possible, not only for the community, but for decision makers inside the department.
Okay, finally, thank you so much. But DNREC, just for people that may be listening in general, the enforcement entity for the state, is that DNREC around environmental policy and health issues?
Yes, in concert with DHSS, Public Health, and for that matter, in partnership with the EPA.
All right, we can call it, because they've talked sometimes about lifestyle issues. Some of the environmental pollutants and the health consequences have been talked about by health entities, not just in this state, but across the country, as lifestyle issues. So when you have Black, brown, poor communities suffering high rates of cancer, emphysema, et cetera, they've sometimes stated, well, that's because of their lifestyle, and they've disconnected that from the environmental factors. I just wanted to put that out there so that we don't have that happening in the state of Delaware, which I think it actually has happened, but this is a great forum to discuss that.
No, and I appreciate that. And just to give you an example, of two examples of us working with Division of Public Health, if we're setting standards, if we're looking at particularly, let's say, drinking water, that's a public health lead. On the kind of the finished water, we've got the source water side, and so there's a partnership there. Or air quality, where we have the jurisdiction over outdoor air quality. Public health has indoor air quality, and so there's a lot of places that we partner with a lot of different both state, even local and federal agencies to address these issues. And so we try not to do any of them in a vacuum.
Thank you.
But next up, Ms. Dora.
Okay, sorry about that. I was trying to unmute. Thank you. Thank you. I would just like to piggyback on some of the things that Michelle Roberts and Jeffrey Richards talked about. And what I guess this live timing that Secretary Garvin alluded to is real-time information. So one thing I like to find out when he says stakeholders, who he's talking about, and also policymaking for legacy pollution. And the other thing I like to find out is if the research that he's doing, or that DNREC is doing with the what is it, State University, Delaware State University, is going to be this gathering of information. Is that going to be included? Because I was to understand that that would not be finished until 2023.
So let me try to hit on a couple of things. When talking about stakeholders, that's a separate thing that we're doing as part of our environmental justice effort. Part of it is the work that we have going on with Delaware State University, but we're not waiting around for that effort to be completed. We're also about ready to hopefully sign a contract with
incomplete information.
Sign a contract with another consultant to help us in pieces of that as it relates to kind of how we evolve in those areas, relying on things like Justice 40, African American Task Force, other groups that are already in place, looking to elected officials, looking at community leaders to really help identify both folks who can self-identify that they want to be involved in these conversations, or identify others as it relates to communities as a good list of community leaders in which we can partner with. So that is an ongoing process. That has been, I think, one of the biggest struggles that we've had in the area of environmental justice is we'll have a number of community leaders that represent a very large area of interest, but trying to make direct contact into specific neighborhoods where we have a good list of so-and-so is the head of the community organization, or there is a place of worship that predominantly represents a community in which we can partner with pastors and others, or there's a community center that has good public outreach. So we're continuing to try to build a structure to make sure that we are getting information in and getting information out of communities. And so I think stakeholder identification is an ongoing process that we need to continue to do, and look to all of you for your help in that area. So when we talk about stakeholders, we're basically talking about anybody we can get at the table who wants to engage in these conversations, either about the tools that we're developing, things that we need to continue to focus on, or specific issues that will impact a certain community. So and there was a second piece of that, which was development of information. Dora, could you repeat?
Oh, yeah, I was talking about this information that you're going to be, this tool to be used to measure and to, I guess, to make policy for legacy pollution. Real-time information for policy that is for legacy pollution.
Yeah, and I just want to be clear, there's a lot of things that are already in place that we're already utilizing that address legacy pollution. And so this is just building on behalf of that. We have our brownfields program, we have our cleanup program. There's a number of pieces out there. As we look at source water, the efforts that we have going on as it relates to PFAS. And so there's a lot of things already going on. What we want to make sure is that when we look at each of those issues, and we're making developing policy or making changes to regulations, as I said before, EJ needs to be part of our DNA. It's not something like that we're going to do EJ for the next hour and then we're going to go back to our regular job. This needs to be part of the way we think and part of the way that we make decisions. And so building these tools help us make it easier when we're trying to make those decisions and look at this information.
Okay. All right. And so I guess what I want to be clear about is that this real-time information that's going to be fed into this tool is, you say, that the stakeholders list is continuing, and the tools that are already being used. A lot of communities, I don't think, know about some of the tools that are being used. So I guess there's a big gap in information. And so when you build this new tool, hopefully the efforts or how this information is disseminated is going to get to communities that maybe the census tract doesn't even report on.
That's
I guess
the goal. I mean, that's the goal. I mean, there's a lot of tools out there, and not all of them are all that easy to use. I can tell you. I mean, I've been involved in this for a very long time, and the tools in the department, tools that I had in other stops aren't always that easy. And so part of the goal of this is for both communities and for staff to have a tool that is easily accessible, easy to use, is very straightforward, very clear, And that's a big area that we are going to need input back from the stakeholders, from the communities, from all of you to say, hey, is this truly something that is easy to use, or is it, Mark and his colleagues are dealing with this stuff for a very long time in the various tools that are out there. But sometimes when you're really close, you think it's easy to use because you understand it all and you've been using it, but that doesn't necessarily translate. And so the goal and the focus is making sure that it is as easy to use as possible for everyone.
Okay, and so this is like, I'm back with Jeffrey again now, that this is going to be used to make policies, correct? That are going to be put in place so that we don't lose track of where we're supposed to be. And last thing, I just want to say one last thing. So when we see you, or when we see DENREC, we are actually looking at DHS and we're looking at housing, correct? I mean, this is across the board. Is that what we're doing?
Well,
I'm just saying.
I understand. I want to manage expectation. This is not going to be everything that a community is interested in the DENREC tool. There, as we talked about last time we met, I mean, there's a lot of things that are impacting communities that are important focus, and they certainly all don't fall or even come close to falling under the jurisdiction of DENREC. And part of my concern is because of all those other concerns, the environmental things don't raise to the top 3 or 4 things that communities are concerned about or households are concerned about. So how do we make sure that we are getting the information to communities to say, hey, look, you need to be concerned about this because it impacts you and impacts your community. So this tool isn't going to be everything anybody in the community wants to see, but it will link back to health, and we will have input and working with housing and DelDOT and others, but we're not going to try to layer all of the things that people possibly want to see in this tool, because I think it would just suffocate under its own weight.
That's interesting. Okay, thank you.
You're welcome.
Thank you. Next up, we have Miss Maria Payan.
Thanks. Secretary Garvin, I have a question in terms of the more rural areas, when you consider a lot of Southern Delaware and you have the incorporated and the unincorporated, where there's, not a lot of the public services like public sewer, public water. I've noticed in other tools that I've used, there's often a gap there when you get out into these areas. And it's something that I'm seeing often, because I think there's not a lot of research and data out there, especially in terms of, for example, if you look at like the air monitoring in the southern part of the state, we have one in Lewis Rehoboth Beach area and one in Seaford, but there aren't. So how, without the lack of data does not mean the lack of pollution, right? So how are we going to gauge that? How is that going to be built into the tool?
So that's a great point, and I've been very clear. A lot of times when we talk about overburden and underserved communities and talk about environmental justice, a lot of times the conversation focuses on our urban areas or historically industrialized areas, and we're focusing on the whole state. That environmental justice issues are issues of rural areas as well, and so the tools that we're creating and as we're evolving into our focus on environmental justice and how we address it in the department, we're looking at it statewide and not just in certain heavily populated areas in the state. And so part of the tools helps us look at and say, well, is there gaps in information? Mark hit on that while going through the presentation how do we determine if there are information that we're missing that makes it more difficult for us to make decisions, and how do we gather that information. And some things like air monitoring have specific purposes, and it's based on population, and it's based on the Clean Air Act and our state implementation plans. And so we also have to look at what the tools are being used for, and how do we, if there are other needs, how do we address those issues? So when you talk about air monitoring, I think that's a little bit, you need to look at what is the purpose of that air monitoring network and the regime for that versus what some other needs might be, which may not be the development or further development of that air monitoring network, because that's not the purpose, but it may be some other air monitoring that we need to look at.
Thanks, Secretary Garvin. And we know your time is limited. You have to get ready and go. I wanted to know what criteria do the two potential contractors have for engaging with overburdened communities?
Well, I'm not sure. I don't know, Mark, if you want to share. I think they're contractors for us in developing the tool. It will be our responsibility in working with the communities to make sure that they're engaged in those processes. Is that a fair characterization, Mark?
Yeah, that's correct. And we'll have kind of stopping points along the way. And, we mentioned we're, creating this in phases. And so we'll determine, once we select the contractor, we'll determine, when those cutoffs are, or when those points are, to when we need to go out to the community and say, okay, here's what we have. And so the contractor will be part of that process, so that they can help explain some of the information behind the scenes. But I think it's going to fall to us to really kind of organize that and figure out how to hold those sessions.
Thanks, Mark.
Thanks, Mark. Is there any potential for hiring individuals from the overburdened communities, as they already have that connection, that collaboration with these communities?
I don't envision right now that was the intent. We certainly want to partner with as many stakeholders as we can, but I don't at this point envision that we'll be hiring community people per se. I mean, if there's an opening in the department, and we're certainly encouraging as many people to explore opportunities in our department. We continue to work on making sure our department reflects the people that we represent. But I'm not sure exactly what type of position you're referring to.
Yeah, pardon me. We'll talk offline. I want to make sure that we can get in any last questions. I apologize for being less clear. Next up,
No, I look forward to it.
Yep. Go ahead, Karen.
Good morning, everyone. Secretary Garvin, I just have a quick question, which is, how were the two contractors selected, and why was it not an open bid? And what two contractors were chosen to submit proposals?
So, Mark, do you want to touch on that?
Sure. Yeah. Well, yeah, we had the Environmental Justice Committee inside of DENREC had started conversations, and a lot of this, we have a existing contract with ESRI, which is a geospatial company, and so that's something that we have actually through the state. I think the open contract maybe. So they're one of them because they're the proprietary developer of these tools. So most of these platforms are built with the tools that ESRI has developed. So we're certainly looking at them. And then Maryland Environmental Service, we have an interagency agreement with them. They're the ones that developed the Watershed Resources Registry that uses ESRI products. Because they have developed that Watershed Resource Registry platform already, there's a lot of benefit to and potentially cost savings to using that infrastructure that's already built. So we haven't selected a contractor yet, and we've kind of just been exploring getting quotes to see what it's going to cost to develop this tool.
And I apologize, Representative Lambert. I have about 3 or 4 more minutes, and then I have a funeral I need to go to. So I apologize for if we get a couple more quick questions, and I certainly take them.
Thanks, Secretary. We appreciate it. Jeff and Michelle, if you have any brief questions, thank you.
Okay, very quickly. Thank you very much. I think with the consultants and having done some work in that arena, if we can set some criteria, there are great consultants around the country that have demonstrated experience working with Black, brown, poor communities in the environmental context, and to broaden that and open up so the opportunities for those organizations are given. Also, typically when something like this is done, those groups aren't brought in. We had an experience where we worked with a government agency. They had consultants. There were no people of color at all in the whole agency for the most part. And we raised that with them. And then they were able to get a people of color consultant to work with them, to work with the communities that had that experience that they did not have, to work with directly with the communities. So you solved the problem. You hired an entity that probably would not have been hired. You addressed the issue of having groups that have very little experience working with people of color in poor communities, who are going to then set the dynamics for what happens in those communities. Not a good fit. So we want to begin to correct some of those inadequacies and inequities in the system itself. And we can maybe talk offline about some of the groups around the country that have extensive experience working with communities of people of color and low-income communities, rural and urban settings, and could probably infuse the process with a whole level of different insights that might be very useful for how policy is set in state. Thank you very much.
Thanks.
Just very quickly, a couple of very quick things. It is very important that we, first of all, honor the roots of information that we have rooted down in our work here. And this is what brought us to this Justice 40. And what we mean by that, Administrator Garvin, came out of the great works of Administrator Di Pasquale, who again tasked folks with a 26-month process, to which that's why we asked the question from that of the Route 9 Industrial Corridor to that of the strong communities in Sussex County, and how it is that we have an intergovernmental agency approach in making sure we understand the laboriousness of the weightedness of a tool. But at the end of the day, we need something that will be functional for the entire state, as you iterated. In addition to that, something that is able to help all of the administrators, all of you together can make a collective whole. And we're at a great point right now, even with the magnificent work that the environmental justice community has done across the board, leading me closing out into the point of that of hiring folks within the community. Even our neighboring state of New Jersey was actually one of the forerunners for some of this of infrastructure monies that are coming down into the state, if not already, to speak to that of creating that of a climate core within our communities, a climate core where we utilize our young people within our communities, and even our young people that may have a reach to that of Gander Hill and Ferris School. But at the end of the day, we need to make sure that these communities are made whole. So thank you so much for your presentation. We're looking forward to hoping that these agencies can indeed work together, because we are at historic and critical, crucial times right now to salvage and save our communities, but equally support that of a president who comes from our state. So thank you for your great work, Administrator Garvin.
Thanks, Michelle.
Thank you, Secretary Garvin. We appreciate your extra time. We know you have to go. Thanks.
Thank you. Thank you all. Appreciate it.
And thank you, Mark, as well. We appreciate it. I want to open things up to Director Codes Johnson. We know that your time is limited as well. We wanted to open it up for your team to be able to provide your screening tool as well. Thank you.
Hi, everybody. Well, I am the team because my team is buried in COVID-19 pandemic response right now. So the epidemiologist who works on this system day in and day out initially was going to join this presentation, but she cannot because we're processing a historic amount of labs for testing this morning, over 7,000. So what she was able to do is to develop the slide deck that she was going to present. So I'm going to give my best shot at actually delivering the information that Alice Crisco was going to deliver. I spent a lot of time on the My Healthy Community Data Portal site just as a layperson using it, searching it to look for information. I won't be able to answer technical questions about the site or the platform because that's not my area in the site, but I will deliver the slides. And if there are additional questions that I can't respond to, I'm happy to take it back to the team and get responses at a later date. And I think Dylan said you made me a co-host, right? So let me see if I can share.
Yes, you should be able to share your screen.
Okay, and get the slides up. Can everybody see the slides? Okay. So My Healthy Community Data Portal, everyone may know it right now because it's also where our COVID-19 data can be found. And so it's gained a lot of notoriety because we were able to quickly pivot using the infrastructure of this platform to be able to share data on a daily basis at this point related to the changes in COVID-19 in Delaware. The COVID-19 portion of the My Healthy Community Data Portal site is actually being lifted up as a national model that other states have now tried to replicate to be able to share transparent data. But the origins of that portal are not with COVID-19. The origins of that portal are the listing of data that you see listed that we actually started working on back in 2016. So this has been a long process to develop the My Healthy Community Data Portal, and the discussions of developing this portal came out of two things. One, we applied years back for Delaware to get funding from the EPA for the Environmental Public Health Tracking Network, if folks have heard of that. There are other states across the country who apply and get that funding. Because Delaware is such a small state and they had limited funding, we were not awarded funding at that time to develop a Delaware Environmental Public Health Tracking Network. But we wanted to develop a platform to be able to show more data, right? And to show more environmental health and other population health related data to the public, right? We collect a lot of data. Each one of those data sets has different rules, regulations, and laws under which conditions that they can be shared and cannot be shared, down to the level of which they can be shared. For example, a lot of HIV data, tuberculosis data, right, are protected data, that there are very strict rules on sharing them on public facing sites. So each and every data set kind of has its own rules and regulations that we have to go through when we think about adding things on the site. So what ended up happening is when we embarked on becoming an accredited public health department, the need for being able to share population health level data to track measures and indicators over time, right, to look at trends over time, became very heightened, right, importance for us to be able to demonstrate that we had a mechanism to be able to look at health issues, look at them over time, and as a public health department, help develop strategies for what's within our sphere of influence, right, to contribute addressing those different issues and disease states. So what we ended up doing is when we did not get the Environmental Public Health Tracking Network funding, an opportunity for funding actually came up through DNREC. And we worked very closely with DNREC and are very grateful. And DNREC actually provided the seed funding for what now has evolved into the My Healthy Community data platform. So what is it? It's a software platform, right? And it provides information to the community in what we hope to be usable and easily understandable format. This is data where people can go and get what they know to be verified, reviewed, validated data that is looked at and reviewed by epidemiologists, then turned into pretty charts and graphs in a usable format by software engineers, but is also HIPAA certified. We have a HIPAA attorney that reviews every data set before it is actually posted. So here are the audiences. So wide range of audiences is really for the general community, right? But the audiences who use the My Healthy Community data portal most often, we're finding our state leadership, community-based organizations, our hospital partners, and also statewide residents. But it's really a platform where anyone can go on for any purpose, whether you're a researcher, whether you're a lay person, whether you're a legislator, whether you're the head of a community-based nonprofit who's looking for some data to help guide the strategic direction of your organization. That is what we hope the platform helps to provide. So here's what you can find on the site right now, right? There are currently 114 indicators on the site right now that cover 10 categories: community characteristics, environmental health, climate change, chronic disease, mental health and substance use, healthy lifestyles, community safety, maternal and child health, health services utilization, and infectious disease. And with each of these categories and with each data set, there is a significant amount of work that goes into the development of each data indicator for each data set. And there's also a significant investment of funding for each data set to make it happen. And so over the last several years, there has been tremendous support and partnership from other sectors, from other state agencies who, as they've learned about My Healthy Community data portal as an opportunity to share validated health-related data on it, have actually invested, paid money and funding. For example, our partners at our sister agency, Delaware Department of Substance Abuse and Mental Health, have provided the funding for many of the mental health and substance use disorder indicators that you'll find on the site. Again, many of the environmental health and climate change data indicators that you'll find on the site right now have been funded and supported by DNREC to be put on My Healthy Community data portal, and other areas within the Division of Public Health, like in our health promotion and disease prevention section and our maternal and child health sections, have given funding as well for some of the data sets to be developed and published in these other areas. So here's what's on the site today. So this is just a quick, I'm not going to read all of these, but I'll leave this up for a second so people can actually peruse and see under each of those domain areas what types of data you can find on the site today. There are rules for data to be put on this site. Again, we're a public health department, and we have to follow certain rules as it relates to HIPAA. Certain data we have is for surveillance purposes only. We've had to enter into data agreements and MOUs with other sectors who have given permission for us to have data, some of these data sets on the site. And so all types of data are not going to be appropriate for this site because of the standards related to HIPAA clearance and other things that we have to clear as a public health department to be able to comfortably show this data without fear of lawsuits or identifying health information for any particular individual or resident in Delaware. The crux of the site is rooted in equity, and that's where I come in. I've tried to really work with the software engineers who work on the site and also the epidemiologists who are very technical and they just look at, right, data for data's sake, they do what they're supposed to do. But we wanted to make sure that the site is rooted in equity, right? And so one of the ways that we ensure that this site is rooted in equity is that the undergirding of it is the methodology of the Social Vulnerability Index. And so for those who, you know, work in this space and know what SVI is, it is a CDC developed national tool that has a specific methodology, and it actually takes 15 different indicators of relative vulnerability, and it breaks it down by census tract for every census tract in the United States. And it comes up with a score or a percentage of what they call relative vulnerability. And so traditionally, how the SVI has really been utilized is actually in the environmental health space, right? To be able to identify areas by census tract that will show you, for example, areas where there's a high heat index, for example, is how traditionally the Social Vulnerability Index has been utilized. But how we used it is it actually is part of the algorithm and the undergirding of how the site is able to break down information that is Delaware specific by geographic area and by race and ethnicity where allowable. Again, we have HIPAA laws, and so some of the data sets, some of the data over time is so small that it won't allow you to display data to the public below a certain level. And so the HIPAA attorney looks at every single data in the data set that once it's cleaned and the software engineers has developed how they want to display it, the HIPAA attorney reviews and basically says, yes, you can display this data at this lowest level, or no, you have to aggregate it up to a higher level because it's violating some HIPAA rule. But the goal on the site is to undergird it using the Social Vulnerability Index, right? To be able to identify those areas that are high vulnerability, but also at the same time show each data set to show it at its lowest available level, right? So census tract, below census tract, block level, some of the data you can actually see at the neighborhood level, at the block group level. Some of the data has to be aggregated up higher, say zip code level. Some of it can only be showed at county level. But when you go in on the site and play around with it, it'll tell you the data set that you're looking at, what's the lowest level, right? That you can engage with that. So we're running out of time, so I'm not gonna go through all of these sites, but the epidemiologist wanted to just give more information about kind of the methodology behind SVI and and how they come up with the measures. But the point here is that the Social Vulnerability Index is a vetted, nationally recognized CDC tool that's been in existence for decades. But now it's being used in new ways. It's being used in additional ways, and I'll show that in a minute. And what we've done is taken the SVI methodology and created basically a Delaware-specific Social Vulnerability Index that you can find on the site. And this just kind of shows what it looks like. So what we're embarking on now and what we started to dip into with COVID-19 is, from an equity perspective, how can you dig deeper and look at the areas that you already know based on and some of this, we don't need this data to tell us, right, where the high vulnerability areas, but it just shows you, it shows it to you in a nice, pretty color-coded map. But those of us who work in the community know where the high vulnerability areas are, regardless of what disease condition you're talking about already. But this shows it to you in a map. And one of the things that are dipping our toe in and started to do with COVID-19 is starting to overlay, right? Different things. Another, I think somebody asked the question earlier about how do you look at like compounding effects, right? Or how do you look at, you know, things that have cumulative impact over time. This site will show you both trend line data on a particular indicator, and we're also moving in the direction of being able to overlay different indicators. So right now, the overlay that we've been able to do is looking at vaccination coverage, because it's such an important issue for us right now as it relates to addressing this pandemic, and highest vulnerability areas. So the overlay that you can see and peruse when you have time on the COVID-19 side of the house on the My Healthy Community Data Portal right now is related to looking at the areas in our state where, according to the Social Vulnerability Index, they're already highly vulnerable and have low vaccination rates, right? And so what's being done with that data is it's being used by community groups across the state who are organized and working in communities to help them target more the areas in which we need to be directing our education, putting more testing resources, offering more opportunities for vaccination and the like. So I'm gonna quickly go through these slides just to kind of show you on the climate change related part of the My Healthy Community Data Portal, the types of indicators that are listed on there now. And if you actually go into My Healthy Community Data Portal, you'll see climate change and you'll be able to see the list of indicators that are there that were shown on the previous slide earlier. So there's Lyme disease data on the site right now. This just kind of shows you charts of what you can see from trend lines when you look at our data related to Lyme disease. Asthma, there are a number of different asthma indicators on the site right now that people can look at. This shows you what you'll see. These are screenshots of what the actual site looks like when you look up these different indicators. So there we have emergency ED visits and what that trend line looks like up and down over the last several years. Asthma hospitalizations in Delaware, heat maps, and there's different ways you can pull up and look at the data. So when you're in an indicator, you can ask for a heat map or you can ask for things like trend lines. It gives you options to look at things in different ways. Asthma deaths is another indicator that's also there. Carbon monoxide is another indicator we have on there. And again, this just shows what you can look at. There's summary metrics, and then you can look at it by trend lines as well. This is basically heart attacks, right? And we know that heart attacks can be associated with many different things. But this kind of shows you the areas related where we see the highest heart attack hospitalizations and where they're presented in our state. Heat stress is another indicator that's up on the site right now that people can look at. Lead poisoning data. And again, some of the rules for the data that can be displayed on My Healthy Community Data Portal are things like there must be a what they call a validated data source, right? That can be tied to the data, and it must be updated on a regular interval, say annually, right? Because what the software engineers and the epidemiologists, again, we're up to 114 indicators, and this site is going to continue to grow and evolve. And there's a lot of work involved on maintaining it on the back end. So one of the rules now is that the data has to have a validated data source. It needs to be updated at its root source at least annually, and there needs to be a feeder, a way to have like an automatic feeder into our My Healthy Community Data Portal for it to update, right? So they run updates on these data every year, right? And all of the data isn't updated January to December, right? So each data set may have a different schedule, right, on when annually it's updated or available, like say from a federal source like the CDC or the census, you know, or wherever kind of the root source data is. So there's algorithms built in for regular update on when these data get updated annually. And some of these data sources, I'm pausing on lead poisoning because the lead data is one of the areas where we need to do more work, right? So there was a lot of work done to get up the lead data that we were comfortable that could be validated at this point in time. But as these data indicators are researched and looked at, and you know the EPIs are looking for the validated sources, they flag and highlight, okay, this is a data set, right? That the data is, you know, some of the data is reliable, but we can tell that there's probably some underreporting here, and there needs to be more work done at the different sources or the different feeders that feed into given lead poisoning data, so that this data can be more robust. So this is one of the data sources that's been flagged, that more work needs to be done on this in the future to try to see if the root sources where we get the data from can be bolstered. The data doesn't necessarily come from us. Some of the data comes from us, some of the data comes from other sources. And then what the epidemiologists and the software engineers do is they do a lot of matching and merging, right? To pull different data sources together to pull it into a chart that's easily understandable for the public. So lead poisoning is one area that was identified by our EPIs that you know, more data and more robust data needs to be looked at, but there is some data, right, that we can use now. You can see some of the trend lines here and what it looks like now. Air quality, our air quality data, a lot of that data comes from our partners at DENREC. They already have a lot of data related to air quality that they share on their sites. And so we partner with them, again, on the root sources of where those data come from. And we're also able to use that as a feeder and pull it into the My Healthy Community Data Portal as well. And this just shows like what some of it looks like. Public drinking water is another data set that you'll find on the site right now. And looking at contaminants. Private drinking water is also on the site, but again, it's flagged as another data source that needs more work, right? Because when you talk about private drinking water, this is only of the wells that have been tested for different reasons over the course of a period of time that we have data for and or are allowed to be tested, right? When you talk about private drinking wells, those are private people's properties. Sometimes we may offer to test private areas, and there's like, you know, a declination for private drinking water testing for different areas. And it's also not something that's done consistent, right, across the state, across all wells. So this data is, again, what we could source is validated data, but we know that there's probably a lot of underreporting in this data source as well. And then this is public drinking water and data in Delaware continue. So that just gives you a flavor of some of the data that is existing right now. There is a feedback button right on the site. And so we've been collecting feedback since the site launched. Again, we've been working on this since 2016. The site launched in May of 2019, just before COVID. There's a feedback button right on the site. And so we received tons of feedback since the launch, and even more feedback since COVID. And so the software engineers get that information directly. It is fed into like their work plans and project plans that they work on, and they're constantly updating and making changes to the site over time. Looking ahead, you know, in the future, there are plans to expand climate change data. There were actually plans to expand climate change data back in 2020, but those plans unfortunately had to be delayed because COVID, and we actually had to build out the COVID side of the site. There are plans to expand mortality data on that site. We currently have a project underway right now with partnering with United Way's Racial Equity and Social Justice Coalition to build out additional socioeconomic and equity indicators on the site. We've been working in partnership with that group since October, and hope that within the first quarter, by the end of the first quarter of this year, there'll be more social determinant of health data that's built out in partnership and working with them. And some of that data will be more data like related to like wealth creation indicators, criminal justice indicators, and more education focused indicators is what United Way's Racial Equity and Social Justice Coalition are really interested in. So we're partnering with them to start to build some of those pieces out. And then also we're redesigning the home and the subject pages. Again, as the site gets bigger and more indicators get added, right? We always have to be mindful of its usability and utility and people being able to find things. And so we're already getting to the place, because there's so much COVID data on that site right now, that we need to look at how to streamline some stuff and redesign to make, to kind of make space and do a new redesign for the new data that's coming online as we move through the year. So I'm extremely proud of our epidemiologists that work on it, the software engineers that help do the data visualization. Was through an open bid contract that happened back in 2016 with optional years. Again, we were very intentional about equity being the focus. And so Green River is our software engineer contractor that we work with, and they have a really good track record in history across the nation of working. They are a social justice software engineer company. So if you look up Green River, like that is their mission. They're a social justice software engineer company. The owner has a software engineer background, but he also was a grassroots community organizer himself. And so working with Green River aligned with the values and the mission of health equity for public health. And we've been really pleased with the support that we've gotten from them on the software engineer side. And so, we're just looking to help provide additional data that can be used for both our purposes and also to support grassroots, efforts to help drive policy change. Again, this site is not for us from a public health perspective, for us to change policy. It's for us to provide validated evidence-based data to the public for people, others to be able to use that data and know, and have confidence in the data sources, and that there are about 10 epidemiologists who are all focused on COVID right now, but normally work on this site on a daily basis to help make sure that the data is validated, up to date, and cleaned. Another important feature that's coming is a community profiles feature. That is something that was given to us through feedback, through usability testing. So that's the other thing we do. On the site itself, there are often calls for different people to do usability testing for different and new pieces of the site that are coming online, or when new indicators come online. And so depending on what the data set is, if it's, for example, cancer data, right, that's coming online, then we would try to reach out, right, to folks like Breast Cancer Coalition and, other folks that are in the cancer, working in cancer space, and those who are interested in cancer work, and say, hey, we want you to look at these data because you may be familiar with it, and tell us, right, do these things kind of make sense? And through usability testing, and actually in the first iteration of the climate change data that's on the site right now, we did that as well. And folks like Octavia Dryden and Marlene Saunders, who are EJ, advocates up and down the state, and others, we connected with them and asked them to bring in others to do usability testing on the climate change pieces that you see up there right now. And so as we go through iterations and look to add more data, like that's part of the thing that's kind of like built into our process, like finding where the subject matter experts are and asking them to tell us if we're going in the right direction or not. But we're looking to build out a functionality called community profiles, and this is something that community organizers asked us for, and that's the ability to go on the site and pick and choose different data sets that you might want to look at together and print it out, like say on a one-pager sheet, right? So if you're interested, I'm in Kent County, so if I wanted to look at what's happening in a particular community in Dover, if I'm able to look at, say, asthma and COVID and substance use disorder deaths, I'm just making that up, right? And put them all together and print them out for this one community in Dover. That's what the community profiles functionality, once it's built out, will allow anyone to be able to do. So that's something that's under development right now. Again, we really want to make more progress on some of the social determinant of health related data, because it feeds so many of the other areas of the data. And we've been stifled a little bit by that, because COVID right now for us takes precedence right now. And so we're still trying to work on those other pieces in between COVID surges like we're in right now, and hoping things will calm down so we can accelerate progress. And I think I will stop there.
Thank you so much, Director Codes Johnson. This is the gold standard. We really do see why, national entities are really looking to mirror this. Out of respect for your time, we know everything that you guys are going through. What is your hard stop? Do you have time for questions?
Let's see, what time are we at? Yeah, I have a hard stop at 11:45. So it looks like we're at 11:35. So it looks like I have some time for some questions.
All right, thank you, everyone. If everyone could keep their questions brief, because I know you have a lot of good questions, starting with Michelle. Thank you.
Thank you very much for this extensive presentation, and looking forward to talking later about it. Just a straight question and to the point. How do you determine medically underserved, and how is that interconnected into that of environmental justice, and looking over time that of the legacy racism across the state health processes, if you will, that dates back to TB, given the fact that the numbers for TB is probably under-recorded, going back to racial segregation, and then for bringing it quicker to the front. I'm really trying to crunch this as quick as possible. you know, we released a report and we understood that we did not have epidemiologists, but we partnered with the Union of Concerned Scientists, we being the community folks and others, and all of what I just shared with you, the inequities among public health in the great state of Delaware, up and down the state, but we focused on Route 9, where we looked at how it is environmental and pollution exposure compromised health. And in addition to that, fast forwarding into COVID-19, how is that all put together, packaged, and addressed, especially given in the public health department, when we released this report in October 2017, we were told that in an op-ed by Dr. Rattay, that our report was inaccurate. The reason for the disparities among health was based on, quote, lifestyle. We were never asked about our methodology. We were never even asked to prove. We weren't even, and in fact, as I said, we partnered with the Union of Concerned Scientists simply because of the fact that we knew we would be questioned as community-based people. I will leave it there. Just want to know, how do you determine medically underserved communities, and how is that incorporated into that of those who have been impacted by environmental pollution? And then last, how are you really looking at equity and justice through the lens of bringing it from that of the tuberculosis epidemic into now COVID-19? Thank you very much.
Sure, those are great questions, Michelle, and you and I could probably talk offline about all this stuff for hours and hours. What I'll just say is the medically underserved, there's data in there about medically underserved residents, and that is a definition that is developed by the CDC. So also you'll find on the site, any data point that you're looking at or anything that you're asking for, you can also find the definition of when we say this term, this is where it's coming from, because this is the data source that we're using, right, to develop it. So we try to be as clear as possible, because the term medically underserved means different things to different people. So on the site, there is some data, right, about identification based on the Social Vulnerability Index census tract, where people can be identified as medically underserved. Again, if you look at that, and also look at COVID-19 data, and also look at any other data point you want to talk about, whether it be higher incidences of tuberculosis or diabetes or pollution or anything else, you will see this site, right, probably pretty well validates the information that you already have, right, in your report that shows, right, disadvantage breeds disadvantage, right? So those areas that are already identified as socially vulnerable based on the 15 indicator algorithm that the CDC developed, now you can see on the My Healthy Community site what that looks like specifically for Delaware communities. And then you can also look at whatever other indicator you're interested in that's available on the site right now. And I've spent a lot of time looking at different stuff, right? It's not, again, rocket science. I think that's why we're all here on this Justice 40 committee, right? But it's not rocket science that the same communities, right, are overburdened, and it's cumulative no matter what indicator that you're looking at. And so hopefully, you know, this data can just help illuminate it, you know, along with all of the other data that's out there, you know, and really help to build the cases for where different investment needs to happen. At least that's my hope with the site. Just on mute.
Oh, Senator Lopez, you're up next. Sorry about that.
Thank you, Representative. I appreciate it. And Director, thank you for your very thoughtful presentation. I just wanted to make a very brief comment, and I'm very cognizant of the demands that are being placed on the division at this time and very grateful for the work that you all are doing. But just as someone who in the last week has visited 2 of our curative COVID testing locations, I have a little bit of a concern for the fact that on both occasions, I think I was the only Lopez in line. And I really just want to make sure, and again, far be it from me to tell you or your colleagues how to do your job. And I would never try to speak on behalf of my colleagues in the General Assembly, especially those on this call right now. But I know how much all of us are very concerned to make sure that that equity piece is getting into that testing piece as well, especially as we're going through this surge. This morning at Cape Henlopen High School, again, it was a very, there was no diversity there in regards to those who had shown up to get tested last week as well. So again, I don't want to say there's a silver bullet for that you need to tell me today or that your division needs to email us all back with today. But with that said, if there are ways that you can share that news with your colleagues in the division, I would appreciate it a great deal, because again, I think it's something that's important in all of our brown and black populations, in our seniors, but especially as we're trying to make that push to get our kids back into the classroom, we need to get them tested, but especially our students of color. Thank you, Madam Director, and thank you, Representative Lambert.
Absolutely, and a great point. And so we know, right, that in some of our Black and brown communities, public health is not the trusted resource, right, to reach folks in those communities. So we actually have contracts and have partnered with and are continuing to partner with many community-based organizations, La Esperanza, LACC, Urban League, NAACP, the list goes on and on. We have active contracts with them to be those trusted voices and carry those messages into the communities that we know, right? Based on that social vulnerability index data that we can see, they use that SVI data. It's a part of their contracts to use that data to help them identify where they need, right, to really be focusing their efforts, and we supply them with what they need. Education resources, access to testing, resources, vaccination support. And so those community partners are working really hard, right, to try to reach those populations, to bring them out, right, and to make sure that they're getting access. And I will definitely, right, take your comments back as well. But yeah, but those are some of the strategies that we are currently employing at Public Health, and investing a lot of money, quite frankly, right, in those agencies to do what they do best, right, to reach the communities that they're connected to.
Cassandra, again, thank you a great deal. And again, just pass that word along. And again, I think we can all agree on the fact that we need to be able to take these testing locations to the community and not have this expectation that they're going to come to us. And I just want to make sure that that conversation is reinforced in those meetings that you all have at DPH. Thanks for the time. And again, thank you, Representative.
Thank you, Senator Lopez. We appreciate that. One last quick question, Director Codes Johnson. Your portal is particularly user-friendly, and the work that you've done with Green River just really shows it. I wanted to know, when it comes to your SVI factors, the different categories you have, I noticed when we look at air quality, when we look at drinking water, there seems to be a little overlap with DNREC. When we look at public safety, we have a little overlap with the Department of Justice. Is there any appetite to expand it out to access to affordable housing, cost burden renters, access to quality transportation, so that all of the other different agencies that are a part of our Justice for the Oversight Committee, labor, et cetera, so that we could have a one-stop shop where in one portal, we could see all of these different factors in one clean way, so that we could have a comprehensive view of our overburdened communities?
Yeah, the answer is yes. There is a desire to do that again, to the extent that it can fit into our criteria so that we can manage it. Does that make sense? Because once we put a data set on there, we're responsible for the management and the upkeep and the maintenance of it. And so with the social determinant of health, additional indicators that are being built out right now in partnership with United Way's Racial Equity and Social Justice group, there will be some indicators tied to housing in there. It spans a wide range of things that they're hoping to work with us to add. Again, there's some education indicators here. There are a few measures related to housing, employment, underemployment, so there's like a whole list. So, but hopefully by the end of this coming quarter, the social determinant of health side of the site will be built out a little bit more in partnership. And again, it's evolving. There'll always be more that, that we could do, but there'll definitely be at least a few more indicators tied to housing in the respect of wealth creation, right? And housing vulnerability is another one that is a big topic. Food insecurity, like food vulnerability. So these are the types of indicators that are underway, being built out right now through the partnership with United Way related to social determinants of health.
Excellent. That's great news. We appreciate you giving us a couple extra minutes. We know you have to go. And I did want to open up a little bit of time to make sure we can get to our public comments. But before we go to public comments, I wanted to open it up if anybody else on the committee has anything to add before we go to public comments.
I wanted to add that I thank you so much for your presentation. My district, District 6, is right adjacent to the city of Wilmington, includes communities of Edgemoor, and also right next to District 7 include the Edgemoor, the coastal zone, and a very industrial area. And we have everything that was brought up about not only environmental justice and pollution for those communities, but with the testing and the vaccine efforts. I really appreciate all that you've been doing, and very interested in your website and social determinants of health. So our community center has been very involved. Bellevue Community Center used to be Edgemoor Community Center. They're very involved in outreach to the community, and so am I.
Yep. Thank you so much.
Thank you, Representative Heffernan. Stephanie?
Thank you so much for the presentations from Generic and from DPH. It's really, really helpful in understanding how you guys are bringing this information together. As DelDOT has begun to identify our requirements and build something, one of the questions I had and in talks with the Office of State Planning Coordination was whether there is an opportunity to leverage the data that's already been collected and the work that's already been done to kind of share, whether it's through FirstMap or, through DTI. But my concern is being able to use definitions of, underserved communities and be able to be consistent with that across the departments and the agencies, and not duplicating work. And so the work that DPH has done is phenomenal. And as it's taken you guys as many years to do that, I think it would take each of us a long time to come up with something that was so credible and substantial and dynamic. And so, I talked to Dave Edgel, the director of state planning. They have a whole GIS coordination there, and from a statewide perspective. And so, is there an opportunity for us as agencies to work together so that we're coordinating and not duplicating, and so that we can, my perspective from a transportation, obviously there are specific data sets that we are interested in, but we'd like to be able to leverage and make sure that all agencies are kind of using the same foundation of what is, a disadvantaged communities, where should we be focused, and where can we account for the federal funds that we are utilizing, so we're being consistent across the board from a state perspective.
Absolutely, Stephanie. Yep, just reach out to me. We can definitely have those conversations again. So just for example, our sister agency DSAM, they needed to develop some type of dashboard as well and put up more publicly visible indicators related to substance use disorder and mental health. They said, we don't have the bandwidth to do this. We don't have the epidemiologists and the time, but we have some money. Can we partner with you, and can it live on My Healthy Community data portal? And it was completely appropriate. And we worked together over the course of the year. And so you can go to My Healthy Community data portal to see the substance use disorder and mental health indicators. So we are completely open and willing to work across agencies, in the most effective way possible. Awesome. Well, I have to jump. I am late for another meeting, but this is an amazing conversation. Feel free to reach out to me, offline. Anyone wants to have any further conversation. Take care, everybody.
Thank you, Director. We appreciate your time. And that last exchange between Director Coates Johnson and Stephanie Johnson, that's what Justice 40 is all about. It's really about that coordination, that collaboration. Breaking down the silos, breaking down the walls, so we can all, be better for all of our constituents. I do want to open it up to public comment. If you'll bear with me, I just want to share my screen. Let's see.
Larry, you're on mute.
Thank you, Dylan. Our next steps at our next meeting, we're going to have a demonstration from the auditor's office in regards to mapping investment benefits, which was done through the ARPA fund investments at the state, county, and municipal level. And we also want to work on incorporating all of the wonderful feedback that our communities generously provided. Dylan, I'll let you take it for public comment.
Great. Okay, so we just so everyone knows, if you would like to make public comment, please use the raise hand feature below. You will have 2 minutes to make a public comment. And starting now, Jay Meyer, you should be able to speak. Hi, Jay, can you hear us?
Yeah, can you hear me?
Yes.
Yeah, hi, my name's Jay Meyer, and I consider myself and our community, Possum Point and Millsboro, stakeholders in this. We've been working on EJ issues for the past 6 years plus due to pollution in our drinking water, air quality, and more. We're surrounded by industrial pollution. We had a health impact assessment done by the University of Maryland Health Department. Mr. Jacoby Wilson, if anybody's familiar with him. I don't know what we're ahead of the curve or whatever, but, we've been working on pollution problems, air quality problems, environmental justice problems for a long time. Would this health impact assessment be of any help to any of the people in the group, or that could help get things moving in our direction as far as knowing what problems we are having in our community? The EJ work has been initiated and helped by Maria Payan from the SRAP group, and also from Michelle Roberts. We've done put a lot of effort into this with these people's help, and we would I would like to know if this health impact assessment would be of any benefit.
Thank you for your comments, Jay. We really appreciate your efforts with Possum Point, the greater Millsboro area. Feel free to send that data over to justice40@delaware.gov, and we will definitely incorporate your feedback. It is appreciated.
Thank you.
Great. Hi, Jay. If you can send that to my email as well, it's dylan.tepper@delaware.gov. That'll just make sure we'll have it. Thanks so much. The next person is Jeanette Swain. You should be able to speak now.
Hi, yes, thank you for the opportunity. I can appreciate both presentations from the Department of Health and Human Services as well as DNREC. But my problem and my concern is accountability. I think there is already enough data to take action on overburdened communities that have high levels of pollution and, you know, whether it be water or air. So I'm not so sure that developing more tools is really going to make any more of a difference, because with regards to the Coastal Zone Act, which was revised in 2019, those regs are not being followed with regards to permitting that impacts the health of the people of the state of Delaware. So if you're going to take 6 to 9 months to develop more tools, well, what are you going to do in the meantime with the tools that you already have available to you, but are not being followed? And that's the end of my statement or question.
Okay, thank you, Jeanette. We are going to move on to Marva King. You should be able to speak now.
Okay, can you hear me now?
Yes.
Okay, thanks, Don. Mine is very quick. I want to say I enjoyed the presentation as well, both presentations. I'm just concerned, very concerned about the fact that we already have an excellent tool out here developed by the Department of Public Health that's built on equity. And that was built by a contractor looking at equity. And my concern is this. I was just, those of you who don't know me, I've been over 30 years in the environmental field. I'm retired, but I work for EPA down in Washington, D.C. in the Office of Environmental Justice. I was their senior policy advisor. And my concern is that I know one of the contractors that DNREC is looking at, and it's a large contract for the agency. I'm not saying anything against the contract, but I don't think they're built on equity. And if you already have a tool in Delaware built on equity, you know, expand that tool. That tool can be expanded to include all the environmental factors you need. It could be expanded to include all the housing factors you need. I believe that this state is only 3 counties. So why do you have to have all these contractors, right? You could build upon that. The various agencies, state agencies, could put money into that to expand it. You already had an open bid with that contractor who has already exhibited what they need to know and what they're doing in equity. Build upon it. I agree with the young lady, Stephanie Johnson, when she said it'd be great.
Hi, Margaret. It has been 2 minutes now.
I'm over. All right.
Yeah, sorry about that. All right, it is 12 and our meeting is scheduled to end and now, but we have time for one more question. Chuck Lex, you can speak now. Hi, Chuck, you're able to speak now. Can you hear us?
Sorry, there we go. Better now?
Yes, you have 2 minutes.
Okay, so a lot of the folks on this call know who I am and know what I'm about, especially Mr. Lambert. We've worked closely together, and you know, I was not aware of this program until today, and I got to tell you, I'm very impressed. I am 1 week away from becoming the official spokesperson by virtue of the presidency of the Newcastle County Board of Realtors. And as such, I would like to tell you that personally, and therefore as part of the organization, we stand ready to join in and help in any way we can, because one of the things that we are really, really concerned with is in fact equity. Everybody deserves a safe place to live. Everybody deserves a comfortable place to live. And the environmental effects certainly play into that. So I welcome any interaction with this group or individually, like Director Young. We would love to get together with you. You know, Senator Lopez, I heard what you said about, you know, people of color. It's a concern. We know that there needs to be something done, and we are working towards that. So any input that we can offer, any input that you can offer would certainly be welcome. Thank you.
Okay, that is the last of our attendees who are interested in speaking. Dora, I see you have your hand up. Representative Lambert, we are over the time, so if you'd like to end this or let Dora speak.
Ms. Dora, if you could keep it to 1 minute because we're over time. Thank you so much.
Dora, you're muted.
Okay, I would just like to thank everyone that presented. And I'm glad to see everyone that's here, including our auditor's office and Eugene Young, Carrie, Evelyn Harris. I'm so glad to see everyone. And I just want to say that I believe that Justice 40, with exactly what Jeanette was talking about and what Marva King was talking about, the one thing that we do have, we seem to have this tool for equity. And I wanted to say that I read somewhere that we must not depend on the eloquence of bureaucracy. We must not depend on the excellence of academics. However, we must depend on the good conscience of man. And this is where we need to head, in equity. That's all I have to say.
Thank you so much, Ms. Dora Williams. I think we'll close with that. I want to thank everyone for coming out today. Thank you for your generous time and your insight. If you have additional feedback, please email it to justice40 @delaware.gov. And we look forward to convening and seeing everyone again in February. Thanks, everyone. Have a great day.